Hi, I'm Dr. Angeli Conti-Lopez, member of the Society of Adolescent Medicine of the Philippines and a practicing pediatrician adolescent medicine specialist. For our organization, the Society of Adolescent Medicine of the Philippines, together with the OH, we had a grant from the USAID Street Shelf Project for the revision of the Adolescent Job Aid Manual. And apart from the material, it comes with a capacity building package for healthcare providers. And so it was really developed in response to a need to update healthcare providers and to be able to respond accordingly to the needs of the present day's adolescent or the generation of today. Because capacity building materials, certain guidelines that guide the Adolescent Health and Development Program is anchored on the then 2009 Adolescent Job Aid. And we see there that the generation that we address in 2009 is definitely different from the generation that we address now in 2023, 2024. Hence, there is a demand really to develop the new Adolescent Job Aid or update the Adolescent Job Aid in that manner. This version is not just content-rich, but also method-rich, getting the experience set and the gap from previous implementation, making sure that those are addressed in this new version of the Adolescent Job Aid, not just in content, but also in its delivery, in its rollout, the methodology, as well as ensuring that there is documentation of experiences. And what's good about the new Adolescent Job Aid Manual, or what we call the ADA 2.0, is that the content is not exclusively coming from the society, but the content is actually in consultation with different experts in different fields that also caters to adolescents. So that includes the Child Protection Network, legal basis for adolescent health service delivery, experts in that field, and even subspecialists of different nature. So one of the challenges as well is that there is scarcity of relevant researches pertaining to adolescents, especially to 10 to 14 years old in our country. There are a lot of barriers with the availability of data, so that our management and approach to this age group could further be strengthened, improved, and standardized. We also know that in terms of evidence building, especially with research, these are mostly controlled environments, and we need to recognize that there is an ecological framework at play, and it's not just evidence to practice, but it also has to make sure that all factors within the ecological framework are taken into consideration to practice what the evidence recommends us to do. And so it's very important that apart from building evidence, we link with different organizations to make things happen.